Okay, get ready because we're going to take a deep dive into this quote.
All right.
The United States does not have health care. The United States has health services.
Hmm.
So
Yeah.
what's that even supposed to mean?
I think that's a really powerful statement.
Right.
And it suggests a fundamental difference
Yeah.
in how we approach health in this country.
Yeah, we've got a ton of research and articles here
Okay.
that explore this idea,
Right.
looking at the business of American medicine, the impact of all this lobbying, and, contrasting the concepts of healthcare as a right
Right.
versus a service.
Okay.
We're talking about the potential consequences for everyday Americans.
Absolutely. Because it's not just an abstract debate.
Right.
This directly impacts the lives of millions of people.
Of course.
So let's break down this quote.
Yeah.
Starting with the difference between healthcare and health services.
So healthcare versus health services,
Yeah.
are they not the same thing?
Not really. When we talk about healthcare, we're talking about a system that prioritizes,
Yeah.
Overall well-being,
Right.
prevention,
Uh-huh.
and equitable access for everybody.
Gotcha.
It kind of implies a commitment to the health of the entire population.
Like a safety net, making sure everyone has access to care when they need it,
Exactly.
regardless of whether or not they can pay.
Exactly.
Okay.
On the other hand,
Yeah.
when you say health services,
Yeah.
it frames health more as a commodity,
What's
something that you purchase.
Okay.
It's a market-driven model
Uh-huh.
where they're providing services for purchase.
So the tension is,
Yeah.
if healthcare is treated as a service,
Mm.
not everybody can access it equally.
Yeah.
So it becomes about who can afford it,
Right.
which is where the whole medical industrial complex comes in, right?
Exactly.
Yeah.
Over the past few decades, we've seen this growing influence
Yes.
of corporate interests in healthcare.
Yeah.
Everything from, pharmaceutical giants to private equity firms acquiring hospitals and physician practices.
It seems like this whole treating healthcare as a service really opens the door
Yeah.
for these people to prioritize profit
Yeah.
over patients.
That's a key concern.
Yeah.
It's a business-oriented approach
Yeah.
that could lead to all these conflicts of interest where financial incentives might overshadow what the patient needs.
Makes sense.
There's even concern about this erosion of the patient-physician relationship,
Oh, wow.
as money seeps into all these medical decisions.
It's like everything's about the bottom line,
It is,
not about the patient.
unfortunately.
We also have a bunch of information on nonprofit hospitals.
Oh, yeah.
That's really surprising.
Interesting.
They're not always as charitable as you might assume.
Right. Nonprofit doesn't necessarily equal altruistic.
Oh, that's
They
it.
receive tax exemptions
Yeah.
for community benefits.
Uh-huh.
But there's a lot of debate about whether those benefits offset the value of the tax break.
Yeah. It's interesting.
Yeah.
We had this case in our research about the University of Virginia health system,
Right.
and it's kind of unsettling.
Yeah.
They're suing patients who haven't paid their bills,
Wow.
even though those patients claim they couldn't access the financial assistance that the hospital was supposed to provide.
That raises a big question.
Yeah.
If nonprofit hospitals are having trouble balancing their charitable missions with the financial realities,
Yeah,
what does that say about the bigger system?
exactly.
It's very thought-provoking.
And then there's for-profit hospitals,
Oh, yeah.
which aren't required to do anything for the community.
Right.
They're just businesses.
Exactly.
Our research shows that they tend to charge more,
That makes sense.
given their business model.
Yeah.
But what's interesting is that studies have shown that
Like,
the quality of care may not be any better.
oh, wow.
So you get what you pay for doesn't really apply here.
So that's something to think about.
It is. We need to be really informed as consumers, even when it comes to healthcare.
We do.
We also can't overlook these private equity firms.
Mm-hmm.
They're buying up hospitals and physician practices,
Mm.
and it's raising concerns about what their motivations are
Yeah.
and how it's going to impact the patient.
Right.
There's one example that really sticks out
Okay.
in our research.
Yeah.
It's Bain Capital
Mm-hmm.
and their investment in HCA,
Okay.
a major for-profit hospital chain.
Gotcha.
And it led to all these aggressive billing practices
Wow.
and even staff cuts,
Oh, geez.
which seems to completely go against patient well-being.
It's like a slap in the face
But,
to the idea of patient well-being.
When financial interests are so heavily involved,
Right.
it really changes how the system functions.
It does.
It shows how viewing healthcare as a service really undermines providing good care for everybody.
Absolutely. It's a good illustration of that.
It's like a ripple effect,
It is.
When one person starts prioritizing profits, it puts pressure on everyone else to do the same,
Right.
just to stay afloat.
To stay competitive.
Exactly.
Yeah.
So how much of the system is truly about the patient
Yeah.
versus just generating revenue?
That's something to think about.
It is.
These are all trends
Yeah.
that you should keep in mind and how they impact you.
We've also seen changes in the insurance landscape.
Oh, really?
Blue Cross Blue Shield
Okay.
is allowing conversions to for-profit status,
Mm.
and it's creating debate about whether their main focus is shareholders
Interesting.
and not affordable health care,
Right.
for example.
Yeah.
Well, Point,
Mm-hmm.
formerly Blue Cross of California,
Okay.
they used the money from their conversion to buy other insurers,
Wow.
which seems to prioritize growth
Right.
over their initial mission of helping the community.
It's not just hospitals then.
It's not. It's the entire healthcare ecosystem.
Wow. That's an important observation.
Yeah.
You know, everything is interconnected
Yeah.
and it affects everyone. This whole healthcare as a service
Uh-huh.
is impacting all these different sectors.
It is. And in the middle of all this
Yeah.
are the physicians
Yeah. The poor physician.
trying to navigate all this.
Right.
They're facing ethical dilemmas constantly,
Yeah.
trying to balance what they believe in
Uh-huh.
with the financial incentives
Yeah.
and potential conflicts of interest.
It's hard to balance.
Yeah. On one hand,
Yeah.
they want to provide the best care,
Right.
but on the other hand,
Yeah.
they're dealing with all these burdens
It is an administrative burden.
and all the financial pressures.
Yeah.
And it impacts their decisions.
It really does.
And this leads to concerns about self-referrals,
Oh.
where doctors will refer patients
Yeah.
to facilities that they profit from.
Mm.
It raises the question of whether they're putting the patient first.
It definitely does.
Yeah.
It all goes back to that quote, doesn't it?
Hey, guys.
If the system is just about health services,
Yeah.
these conflicts are going to happen.
Exactly.
It becomes a constant struggle to balance the two.
It does.
And that balance can easily go in the wrong direction,
Yeah.
especially with all this money involved.
Money talks.
Money does talk, unfortunately.
Now let's talk about the lobbying,
Okay.
because this adds a whole other layer.
Yeah.
The numbers are crazy.
Okay.
Health industry spending on federal lobbying
Yeah.
increased by 70%
Wow.
between 2000 and 2020.
That's a lot of money.
That's a huge amount of money going into influencing policy.
Jeez. It's not just about the money, though. It's
Right.
who is spending it
Yeah,
and whose interests they're representing.
exactly.
You know, pharmaceutical and insurance companies are the top spenders here,
Right.
with a lot of influence on legislation, like the Inflation Reduction Act.
Even more concerning is how much power is concentrated.
Right.
You know, a small group of firms are responsible for a lot of spending,
Wow.
and it could silence other voices and perspectives.
That raises questions about fairness and whether the system reflects what everyday Americans need.
It's almost like a political tug-of-war.
Kind of.
Those with the most money have the loudest voices,
Right.
and everyday citizens can't be heard.
Unfortunately, that happens a lot.
So we go back to our quote.
Yeah.
The United States does not have health care.
Uh-huh.
The United States has health services.
That's a good way to put it.
Yeah. We see a system heavily influenced by financial interests and lobbies,
We do.
and it creates a disconnect between those who need health care
Yeah.
and those who profit from it.
Unfortunately.
So if the average American can't lobby the government the way these big companies can, how do we make sure healthcare is a right
Yeah.
and not just something for the wealthy?
Right.
How do we make sure everyone has a voice?
That's a big question.
It is.
How do we advocate for a system
Yeah.
that puts Americans first,
Right.
not the bottom line?
How do we shift the focus
Yeah.
from health services
Yeah.
to healthcare as a right?
Yeah. Those are the questions we need to be asking.
Absolutely.
Oh,
And we're going to explore those questions
okay.
in the next part of our deep dive.
Right.
We're going to look at the potential consequences
Interesting.
and how they might impact the future of healthcare
That'll be good.
in this country.
Sounds good. You know, it's easy to get overwhelmed by all this,
Yeah,
but it's important to see how this all connects to the bigger picture.
absolutely.
Yeah.
We've definitely painted kind of a bleak picture,
Yeah.
but are there any signs of hope?
There are some.
Okay.
You know, are there any people or organizations pushing back against all this?
Yeah. Like, give us something to feel good about.
Okay, well, there are some healthcare organizations that are trying to break the mold,
Okay.
you know, trying to balance their finances with their commitment to the community.
Okay. Like what?
Yeah.
Give us some specifics.
Well, there's Iora Health.
Okay.
They're a primary care provider network,
Uh-huh.
And they use technology to be more efficient and expand access to care. They've secured a lot of funding to scale up their model,
Okay.
which shows that investing in innovation can be good for both patients and the bottom line.
That's good to hear.
It is.
The positive change is possible.
It is.
Okay. Are there other examples like that?
Yeah, we found some nonprofit hospitals
Yep.
that are addressing what's called social determinants of health.
Social determinants of health.
Yeah, it's
l-
basically recognizing that healthcare is more than just going to the doctor.
Okay.
It's about addressing all these societal issues that impact health.
Okay. So, like, what are those?
Think about where you live,
Uh-huh.
access to good food,
Okay.
education levels,
Right.
the safety of your neighborhood.
Makes sense.
All these things affect your well-being.
Okay.
Those are social determinants of health.
So these hospitals are finding ways to address these things.
Exactly. For example, the Henry Ford Hospital System has this early college program,
Okay.
and they're training students for jobs in healthcare.
Oh, that's cool.
It's investing in workforce development, which helps the hospital and the community.
That's a great example
It is.
of how a hospital can really make a difference.
Yeah.
It's about more than just medical care.
It's about the big picture.
Yeah.
Another good example is Trinity Health
Okay.
and their Transforming Communities initiative.
Wow.
They tackle things like smoking,
Yeah.
food insecurity,
Right.
and even improving the environment in poor communities.
They're really trying to get to the root of these problems.
They are. They're not just treating the symptoms.
These are inspiring initiatives.
They are.
They're showing us that we can do things differently,
Yeah.
that we can prioritize prevention and the community.
Yeah.
But what about the bigger issues,
Yeah.
like the lobbying and the politics?
Well, there are some groups that are working against that,
Okay.
like the American College of Physicians. They want stricter rules for nonprofit hospitals
Right.
and policies that protect patients from all those crazy bills.
Yeah, that's really important work. We need to make sure that nonprofits are doing what they're supposed to be doing.
Exactly.
What about all the medical debt?
Yeah, that's a big problem.
It is. Are there groups tackling that?
Yeah, like the National Consumer Law Center.
Okay.
They're protecting patients from going bankrupt
Wow.
from medical debt.
That's incredible.
They're fighting for better financial assistance programs,
Okay.
and they're stopping hospitals from suing patients.
It's great to see these groups fighting for patients.
It is.
It shows that people are paying attention.
They are.
But what can the average person do?
Yeah, it's tough.
It feels like a huge system.
It is. But every voice matters,
Okay.
and we need to work together.
Okay. So what can we do?
Well, supporting those patient advocacy groups is a good start.
Yeah.
You can donate to them, volunteer for them,
Uh,
or just talk about them with other people.
Okay.
You can also call your representatives,
Okay.
tell them to support policies that put patients first.
Right. And just being informed is important.
It is.
We need to have these conversations and share this knowledge.
Absolutely.
It's a step in the right direction.
It is.
We've also found some good things happening with transparency.
Oh, yeah.
Hospitals have to show their prices now. They didn't always have to do that.
That's a good step.
It is. It's
Yeah.
a step towards more price transparency.
It empowers patients
Yeah,
to shop around and find better prices.
exactly.
It also holds hospitals accountable.
Makes them think twice about their pricing.
Hopefully, it'll lead to more competition
Yeah.
and lower prices for everyone.
That would be great. But prices are just one thing.
Right.
What about the relationships between doctors and the industry?
Yeah, there's a lot of concern about that.
There is. Are there any positive changes there?
There are. There's this program called Open Payments.
Open payments.
Yeah. It started a few years ago,
Okay.
and it requires companies to show any payments they make to doctors.
So we can see if our doctors are getting money from drug companies.
Exactly. It's all public.
That's amazing.
It is.
So patients can be more informed about their treatment.
Exactly. It puts patients back in control.
That's great. And speaking of empowering patients,
Yeah.
what about all those organizations that are fighting for change?
There are a lot of them doing great work.
Like who?
Well, the American Medical Association,
Okay.
they're pushing for policies that support doctors
Go ahead.
and reduce all that paperwork
Right.
and promote a more balanced way of doing healthcare.
So doctors have a voice in the future of healthcare.
Exactly.
Yeah.
What about patient advocacy groups?
Are there any that stand out?
Yeah. A lot of them are doing great work.
Uh-huh.
You know, they're speaking up for those who are struggling with the system. They're
Well-
fighting for affordable health care
Uh-huh.
for everyone.
It's good to know there are people fighting for us.
It is.
But how does all this connect back to that quote?
Right.
The United States does not have health care.
Yeah.
The United States has health services.
You know, that quote really reminds us of
Mhm.
how much work there's left to do.
It does.
We need to stop thinking about healthcare as something you buy
Right.
and start thinking about it as a human right.
So it's a call to action.
It is.
Right.
We need to change our priorities,
Yeah.
challenge the status quo,
Right.
and demand better.
We need to go beyond just providing services
Yeah,
and create a system where everyone can get the care they need,
exactly.
regardless of their income.
It's about recognizing that healthcare is a right,
Yes.
not a privilege.
Absolutely.
Yeah.
So where do we go from here?
Well, it starts with awareness
Okay.
and education.
Uh-huh.
The more we understand the system,
Yeah.
the better we can advocate for change.
Okay.
We need to support the people who are fighting for us.
Right.
We need to have these conversations,
Yeah.
share this knowledge,
Yeah.
and talk about it with everyone.
And demand better from our leaders.
Exactly.
We all have a role to play in this.
We do. It all comes down to this.
What's that?
We got to stop thinking about healthcare as like a product, something you buy.
Yeah.
We need to see it as part of a fair and just society.
So you're saying we need a totally new way of thinking,
Yeah.
a paradigm shift
Exactly.
about how we view healthcare.
A healthy population is a strong population.
Right.
We need to invest in all Americans.
Makes sense.
It's the right thing to do.
Uh-huh.
And it makes sense economically.
Why is there so much resistance to that?
It's complicated.
Okay.
It's deep in our history and culture.
Hmm.
There's this idea of personal responsibility,
Right.
and people don't want the government involved.
Even with healthcare.
Yeah.
But we've seen that the market approach doesn't work.
It doesn't. It creates a system where your income
Yeah.
and where you live
Right.
determine your care.
Exactly.
The evidence is clear.
Yeah.
The system isn't working.
It's not.
Costs are too high.
Yeah.
And our health isn't good.
It's not.
We spend more than any other developed country,
It's true.
and we're not healthier.
So what do we do?
There's no easy answer.
Yeah.
It's going to take a lot of changes, both in the system
Right.
and in our culture.
Makes sense.
But one thing's for sure,
What's that?
healthcare is a right.
Not a privilege.
Exactly. Everyone deserves it.
Regardless of income
Or background.
or anything.
Exactly. It's about putting people first,
Okay.
not profits.
We need to value everyone.
Yeah, that's the point.
We need to focus on health,
Yes.
not just treating diseases.
A system that helps people thrive.
That's the goal.
It's a big job.
It is, but it's possible.
We've seen people making a difference.
Yeah, we have.
It's up to all of us
It is,
to be
right.
informed, to
Wait,
get
yeah.
involved.
And speak up.
That quote,
Yeah.
the United States does not have health care.
Uh-huh.
The United States has health services.
It's a powerful statement.
It is. It shows what's wrong.
It does.
But it can also inspire us.
to do better.
Yeah,
It reminds us that we can change things.
we have the power.
To create a better future.
Where healthcare is a right.
For everyone.
A just and healthy society.
That's what we need to work towards.
Absolutely.
Thanks for joining us for this deep dive.
Thanks for having me.